Hello, I am Dr. Joseph Isaac, former Assistant Professor of Clinical Psychology, Government Medical College, and writer of 4 books on psychological treatment. Before I go specifically to my today's topic, treat your mind by psychology without drugs. I find it highly imperative to dispel 2 main mythical beliefs that prevents people from availing psychological treatment at the appropriate time before they get lost in the toxic world of drug addiction. The public at large is misled to believe in the Himalayan lie that brain chemicals create mental illnesses and that mental disorders are caused by genetic aberrations. Another Himalayan lie that is propagated in the mental health field need to be mentioned here for your information. The great lie that psychological treatment is mere ready-made counseling and it won't work with mental disorders. This is yet another lie deliberately cooked and propagated for the easy sales of psychiatric drugs to make people believe that toxic drugs are the only solution for their mental distress. Clinical psychological treatment. Clinical psychological treatment is not mere counseling, but highly sophisticated conditioning technology of treating mental illnesses based on the laws and principles of experimental psychology like hypnosis, behavior therapy, biofeedback, psychotherapy, thought control technologies, and scientific methods of stress management. With the above introduction, let me challenge the 2 mythical beliefs that I already mentioned above with authentic information from great scientists in the field. The 2 mythical beliefs are the following. 1. The belief that your brain is your mind, leading to dogmatic materialism. 2. Mental disorders are disorders of the brain, leading to drug addiction. According to me, both these conjectures are superstition. Both these conjectures are superstitions cooked by psychiatry and reinforced in society for long by blind faith and massive propaganda. Both these unexamined beliefs are considered scientific by people because people with scientific background propagate these lies. In my previous talks, while I was talking about the philosophy of mind, I was trying to challenge the shaky foundation on which the materialistic neuroscience and materialistic psychology are built propagating the false belief that your brain meat is the mind. This mind-brain identity theory is practically hindering all our personality growth. Patient participation in healing and is highly detrimental in the successful treatment of mental disorders. In actual reality, your brain is only a piece of meat, like any other meat, a material receiver stuff of the mind. Brain, like any other material object, can be quantified, measured by physical tests, and it has a special location in your body, and hence it is a particle form of manifestation. On the other hand, your mind is a non-material field of force. Your mind is a non-material field of force, not confined to the brain alone, and has miraculous power to act upon matter in the human body. Mind can never be measured by any medical tests like stethoscope, blood tests, brain scans like PET scan, SPECT or MRI scan, and other histopathological assays, or its manifestations can never be revealed accurately with such medical tests. Brain surgery, as you know, can never be considered as mind surgery. Mind is controlled by Schrodinger's wave mechanics and not by Newtonian classical mechanics. Mind is thus not located or confined to a specific position in the body, and hence I would say that mind is non-local, a manifested form of reality in the waveform in the cosmos. Thus, both mind and brain are different and distinct realities, and definitely not one and the same. Mental disorders like depression or mania is not a brain disease but a mind disease. Schizophrenia is not a brain disease but a mind disease. Brain tumor is a brain disease, but phobia of brain tumor or fear of brain tumor is a psychological disease that needs psychological treatment. See how meaningfully these nosological categories are differentiated in the clinical field. Representing mental disorders as brain diseases is a logical fallacy and Himalayan blunder cooked in mental health to promote indiscriminate drugging, and therefore it has absolutely no merit, and hence it is discarded here outright. In the history of neuroscience and neuropsychology, great scientists like Charles Sherrington, Donald Hebb, and others have tried to unlock the mystery of mind and had created and had reached astonishing conclusions, giving the mind an independent status from the material brain. Brain is a material reality, mind is a non-material reality. Brain is a material reality, mind is a non-material reality. The famous Canadian neurosurgeon Wilder Penfield had done elaborate experiments on the different parts of the human brain, which include electrical stimulation of a wide variety of brain areas among living, awake human beings. Penfield finally concluded his findings in the following manner, within quotes: none of the actions we attribute to the mind has been initiated by electrical stimulation or epileptic discharge. There is no area of grey matter, as far as my experience goes, which local epileptic discharge bring to pass what could be called mind action. What the mind does is different. It is not be accounted for by any neuronal mechanism that I can discover. To expect the highest brain mechanism or any set of reflexes, however complicated, to carry out what the mind does and thus perform all the functions of the mind is quite absurd. Penfield, 1958-1975. In his famous book, The Mystery of the Mind, Dr. Wilder Penfield provides ample evidence of the speculation of an independent mind. His evidences are based on his experiences as a brain surgeon who had extensively experimented the brain functions of epileptic patients. His studies gave him the impression that mind is an independent non-material unit that can have the potential to give directions to the brain. I take this opportunity to quote Dr. Penfield in detail here, within quotes: for my own part, after years of striving to explain the mind on the basis of brain action alone, I have come to the conclusion that it is simpler and far easier to be logical if one adopts the hypothesis that our being does consist of two fundamental elements. Close quotes. Sir John Eccles, the great neuroscientist who won the 1973 Nobel Prize in Physiology or Medicine for his work on the synapse, refuted the mind-brain identity theory and called this promissory materialism. His theory of mind is popularly known as dualistic interactionism. John Eccles, in his famous book, The Wonder of Being Human, Our Brain and Our Mind, had said, within quotes, we regard promissory materialism as a superstition without a rational foundation. The more we discover about the brain, the more clearly do we distinguish between the brain events and the mental phenomena, and the more wonderful do both the brain events and mental phenomena become. Promissory materialism is simply a religious belief held about dogmatic materialists who often confuse their religion with science. In his another famous book, evolution of the brain, creation of the self. He added, I maintain that the human mystery is incredibly demeaned by scientific reductionism, with its claim in promissory materialism to account eventually for all of the spiritual world in terms of patterns of neuronal activity. This belief must be classed as a superstition. We have to recognize that we are spiritual beings with souls existing in a spiritual world, as well as material beings with bodies and brains existing in a material world. Close quotes. From what is said above, it is very clear now that mind is a different entity from the brain, and hence it necessarily follows that mental disorders are different from brain disorders. Therefore, the problem of mind and its maladaptive behavioral patterns should be treated by the mind technology in clinical psychology, taking into consideration the psychopathology of the given case. People with mental disorders have deep-rooted problems in their thought processes, and their thought disturbances can be treated successfully with the thought control technologies in clinical psychology without taking any drugs, seeking their cooperation. No drugs are needed for cooperative patients. Giving a psychiatric drug to a person with mental disorder is not mental treatment, but only regularly poisoning his body without studying the causative mechanisms associated in behavioral abnormalities. Such drugging is a chemical assault to his physical body for creating disabling effects in the brain and body. Disabling effects should only be created to a minority of patients who needs to be disabled as a transient measure. With informed consent. That is why I say psychiatric treatment is not scientific form of managing psychological issues, but a chemical or physical suppression. Psychological treatment without drugs. Psychological treatment without drugs, probing deep into the intra-psychic thought processes of a person, is the only scientific way of effective communication that creates healthy psychological climate for conflict resolution and disentanglement of its unhealthy defenses. Today, the treatment of mental disorder has denigrated to a deplorable and pathetic situation, highly mechanical and drug-oriented and not mind-oriented. People blindly believe in inert chemical toxins as healing agents and subdue their free will and choice and get themselves imprisoned in the world of chemical lobotomy. All this happens because of the domination of materialism that has penetrated in the field of psychology and mental health. When the worldview derived from physics is moving towards a non-mechanical, non-material and conscious universe, Psychiatry is getting intoxicated with the materialistic orientation, drugging people indiscriminately for their emotional pain and negative emotion. The great science of physics, experimenting the material constituents of the universe, has revolutionized our understanding of matter by positing that solidity is an illusion or maya, and all matter in the ultimate analysis is nothing but vibration of energies, and the so-called solid matter does not exist. This radical paradigm shift in physics must revolutionize psychology and the treatment of mental disorder. The great British physicist, astronomer and mathematician Sir James Jeans had formulated this paradigm shift in his famous book, The Mysterious Universe, in the following manner. Within quotes, today there is a wide measure of agreement which on the physical side of science, approaches almost to unanimity that the stream of knowledge is heading towards a non-mechanical reality. The universe begins to look more like a great thought than like a great machine. Mind no longer appears as an accidental intruder into the realm of matter. We are beginning to suspect that we ought rather to hail it as a creator and governor of the realm of matter. Close quotes, page number 137. Clinical psychologists who are great experts in the science of quantum mind must show the courage and intellectual humility to incorporate and introject the non-materialistic worldview derived from the experiments of quantum physics, and must strongly advocate the psychological approach in dealing with mental disorders. Psychotherapy without drugs can definitely change the biology of genes, the biology of gene expressions and neuronal structures. Studies have shown that mind influences the genes. And it has the power to influence the growth of stem cells also. The great Nobel Prize winner, neuroscientist and professor of biochemistry and biophysics at the College of Physicians and Surgeons at Columbia University, Dr. Eric Kendall, had appropriately said, within quotes, there is no longer any doubt that psychotherapy can result in detectable changes in the brain, close quotes. Dr. Kendall received the 2000 Nobel Prize in Physiology or Medicine for his dedicated research on neurons. There is a growing body of research evidence to suggest that the talking therapies or psychotherapies without drugs that clinical psychologists do cause neuroplastic changes in the brain. the great science of psychology, the science that deals with the vibrations and reverberations of the quantum mind, must concede the radical view that mind and brain are two dualistic forces in nature, with different manifestations of the same reality. Propagating that the brain is the mind leads to reductionism and constricts the possibilities of the limitless mind, making it imprisoned in the brain meat. Mental health experts must understand that a lump of meat like the material brain cannot produce consciousness or mind, and that consciousness is fundamental in the universe like light or electricity or gravity. Mind is not an epiphenomenon produced by the brain. Just like the light in your room is not created by the room, or the oxygen in the lungs is not created by the lungs, or the oxygen in the lungs is not created by the lungs. The mind that interacts in your brain and neuronal processes and cellular network and activates the hardware of the entire body is definitely not created by the lump of brain meat. This radical idealist realization of our worldview should definitely revolutionize the treatment of the mind. You must understand this fundamental reality that your brain meat is not your mind, and the brain chemicals cannot produce the mysterious and beautiful expression, the intelligent expression called the mind. Therefore, mental health experts should stop exaggerating the meat of the brain, ascribing it having magical properties. This is what I call brain hysteria. Over-exaggerating the brain and teaching people to rely on chemical addictions have damaged our mental health treatment and quality of the life of people. So, stop this brain hysteria. And empower yourself with your mind power and be a dazzling miracle. Science has exaggerated the brain meat at a gargantuan level. And kept it in a high pedestal in the minds of people. And in the name of science, millions of cooperative people throughout the world are branded as mentally ill by instant diagnosis and prescribe poisoning chemicals, drug and damaged for their imaginary mental illness, thereby destroying and disabling their physical brain and body on the silly realization that disabling the brain meat is treating the non-material human mind. None of these minds are healed. And the signals of their distress or emotional wounds are not properly addressed with psychological insight in an empathic relationship. They are thus compelled to live in a world of chemical suppression and quiet desperation. They live in prolonged hopelessness and helplessness in drug addiction, finally making them drugged zombies due to the unhealthy domination of dogmatic materialism in science. The famous American psychiatrist Dr. Peter Breggin, who is relentlessly engaged in the process of reforming, in the noble process of reforming the materialistic drugging in mental health, called this disability of people taking psychiatric drugs as iatrogenic helplessness. I am very happy to understand that Dr. Breggin is an advocate of psychological, humane approach in mental health. In his famous and revolutionary book, Toxic Psychiatry, Dr. Peter R. Breggin, who is popularly known as the conscience of American psychiatry, had criticized the abuses of psychiatric drugs and yet explained in detail why therapy, empathy, and love must replace the drugs, electroshock, and biochemical theories of the new psychiatry. Thank you very much.